Thank you very much for your high willingness to listen to my presentation. This is the last presentation in this project for this conference, and I will try to make some probably additional notes and that could be useful in if you will decide to implement telementoring in the future. So my presentation, as it is noted in title, I will present lessons that we learned in telementoring. As telementoring, as you know, is training of professionals, and of course this was training not only for the professionals but also for trainers, and probably a new definition of telementoring could be also training of trainers like this. So okay, in my presentation I will cover aspects of our idea and how we realize this idea. Also, I will shortly repeat methods and processes that was implemented in our pilots. And also, the probably most important part of my presentation will be results from our pilots, and also about possibilities and problems we faced in implementing pilots. Telementoring idea was from the beginning we planned that and we thought that telementoring, like face-to-face mentoring, may be particularly useful for health professionals, for postgraduate training and education. By idea, we also expected that medical professionals have to have their own working space on web to access information, and also to share this information, to communicate with peers and colleagues, and also to have tutor mentors for their practice. And also we knew that such possibilities to communicate with colleagues and other professionals could be important tools counteracting professional isolation and brain drain in primary care. And how we realized this project, so we, as you already know, we implemented 5 pilots in 4 countries, in Belarus, Estonia, Finland and Lithuania. Full project duration was 2.5 years, but of course main implementation took only 1 year, so this was quite a long time from the beginning, when we needed to prepare our mentoring program, also to equip our training sites, and also to prepare lectures for our mentees. So this took much longer than real pilot implementation. And in this my presentation, I will cover. I will present data analysis of healthcare professionals, those who participated in pilots, views and experiences from participation in telementoring program. Also, our lessons learned. The main principal aim to all our pilots was to support healthcare professionals and give them opportunity for continuing education using ICT technologies. And also, second task, as it was in our application, it was to counteract professional isolation and brain drain in rural areas. In our pilots, we included only primary care specialists, so it means doctors and nurses. And another inclusion criteria was that they have to be from rural or remote workplaces. For the mentoring, we used web lectures, seminars, also chat rooms, forums, Also, we had expert-led discussions, online meetings, virtual classrooms, and many other type of mentoring methods. Main technologies for communication and for the lecturing was Moodle, Skype, and OVO. So this is mostly open access software. Also, our project was not, like in general, made as a scientific project, but we also found that it is important for us to know what is the effect of our implemented pilots. So we used also questionnaires and also interview methods to assess effects from the telementoring. And in our pilots from 4 countries, the main participants were physicians, and there were 52 physicians and 26 nurse mentees. By the gender composition, the biggest part was female participants, and 44 of them were more than 50 years old. And practice duration was also more than 10 years. We did analysis in before and after implementation. So in telementoring pilots altogether, we found that after implementation increased self-confidence in making decisions. And this was also statistically significant change in our pilots. Also, our participants has increased experience and knowledge how to solve everyday problems in their practice. And this also was statistically significant change. Also, we asked our participants before and after how they feel, do they have experience and know how to solve rare cases. And this was also slightly positive change after implementation of pilots, but statistically significant change was not seen. We also asked our pilot participants, do they feel that telementoring can be used to support the professional development, and there was also slightly positive change, but this was not significant. Our participants also think that use of tele devices for telementoring is suitable for them, and this was also statistically significant change. Our participants noted that they like technologies to communicate with colleagues, and this acceptance of technology was higher at the end of our pilots, and there were 18 participants who had a more positive attitude after implementation of telementoring pilots. One of the important questions in pilots was, do they feel professionally isolated? And at the beginning, there were more participants who were feeling that they are professionally isolated. But in general, professional isolation had quite low evaluation by the mentees, and this also after implementation, this feeling that they are professionals related also were slightly lowered, but this change was not significant. And also very important question at the end was to ask the participants, do they still willing to work in the working places in remote areas? And there was significant increase after implementation. Those who told that they are willing to stay in remote areas and willing to continue their practice. So this also positive change was sought in 17 participants. What we have learned by implementing telementoring. So there are supporting factors that can promote implementation of telementoring pilots or telementoring programs in countries. So one of the important factors is that there is no need for those who participate in these programs. They don't need to travel. Also, they save the time, the finances. They can allocate this time that was saved for the patients, and they are also this can be one of the reasons for the telementoring implementation in the future. Also, there is another possibility that after learning in web environment, our participants had possibility to any time to stop, to repeat, or to pause session. So they did this at any time that is convenient for them, and this is also could be one of the good things to implement telementoring. Also, we saw that knowledge was gained more faster and more widely spread by implementing telementoring. And also, if we have motivated staff who wants to participate in telementoring programs, and if we have young professionals who like to use technologies to be trained or to get new knowledges. This is also could be one of the factors when we can plan telementoring programs. Also, we learned that we have not only supporting factors, but there are amount of limiting factors to implement telementoring, and one of important factors is lack of technical infrastructure in primary health care centers, and not everyone primary health center and not in every country has sufficient infrastructure, technical infrastructure. So there is need for additional investments to run such programs. Also, in countries, we saw that there is some legal aspects that is not solved until now, and to implement telementoring or teleconsultation, it can also give some problems because this type of activity is not regulated. Also, if it is not regulated, it is not paid, and many problems that if we want to continue, we have to solve. Also, one of the limiting factors is lack of time from the professionals who participate in such trainings. So they have to allocate some time for their professional career or professional training. Also, some participants has lack of motivation to participate. We saw that this telementoring programs is not for everyone and not everywhere. And we have to make selection of participants who really wants and who really needs technology to be trained. So motivation is also very important when we plan mentoring or teleconsultation programs. Also, for some participants, physical contacts were more preferred. So it is also we have to know this, and probably in selection of participants, it is also could be one of the important factors. Some participants also had a lack of computer skills, and this also was need for high workload to support them using technologies. And computer skills is also is important in running pilots. And one of the limiting factor was also high workload required to run program. It means that we needed a lot of time to prepare lectures to run this program, and this is also can be limiting factor. What problems we had in telementoring? This one of the important problem was Moodle environment, because it is quite complicated and technically was a need for the mentees to make a lot of clicks to find information that they need, and in the future we think that there is need to use or to make more user friendly. Also, one of the problem was that mentors and technical staff workload is quite high, and of course this is related to not only to time but also to financial issues. If we will continue such programs, and if infrastructure or technologies will be the same, we need to have a lot of technical support staff to implement programs. And of course, some specialists had a lack of own motivation to participate, and selection should be based on motivation also. What we learned about professional isolation and brain drain in telementoring using telementoring. Our pilot participants have expressed that in general, they don't feel high professional isolation in their practices, but they also admitted that some degree of professional isolation can also lead to brain drain. So professional isolation and brain drain is interrelated factors. Also, in general, telementoring doesn't counteract brain drain itself, but it could be also. But it was noted by participants that it could be helpful to support young medical professionals and medical personnel to go to work in rural areas, and probably this could be a tool for young professionals, those who also well trained in technologies. They can also be supported by telementoring, and probably this can help to make rural areas more attractive as a workplace. And also, our participants think that telementoring could counteract professional isolation if those persons who participate in mentoring program, they are self-motivated to use technologies. And in conclusion, I would like to tell you that implemented telementoring programs supported professional isolation, and our results shows that there was statistical significant increase in competences and confidence of mentees to solve everyday problems in their practices, and to make the professional decisions more actively. Also, we can conclude that among our mentoring program participants were statistically significant increase in acceptance of ICT technologies and telementoring itself. But despite these problems and limitations that I told you, we also understood that implementing of telementoring programs, all our participants agreed that it could be also useful in some extent tool to counteract professionalization and for those who really wants to do this. So thank you for your attention, and